Hey everyone, welcome to my channel. I'm Dr. Inyoja. So today I'm talking about hypoglycemia in a diabetic patient. Now you know diabetes, we deal with high blood sugar. That's what diabetes is all about. Now hypoglycemia means low blood sugar. So we'll talk about how somebody with diabetes, which is high blood sugar, tends to go down to low blood sugar, which is actually dangerous for one's life. Hypoglycemia means when the plasma glucose level is low. Now it can range from 50 to 70 milligram per DL. So hypoglycemic symptoms within this range. Now, hypoglycemia, the question is what actually causes hypoglycemia in a diabetic patient? Now, what causes is taking high dosage of your medication. Now, medication by means what? Medication that help tends to bring down your blood sugar so that it will not be too high. Now, when you overtake the drug, it can actually lead to hypoglycemia, meaning it will bring down your blood sugar way below normal, which is dangerous to your health. Another cause is when you take your medication without eating. Now, as I said, when you eat food, your sugar level increases. When you take the medication, your sugar level decreases. But if you take the medication without eating, it can bring down your sugar level way below normal, and then it is dangerous for your health also. Some people, again, will take their drugs and then start exercising without eating, believing that because the sugar level is high, the exercise brings down the sugar level, and then if you exercise without eating and after taking your drug, it can lead to hypoglycemia. Some people, their diet does not even contain any carbohydrate at all, while they are still taking medication for the diabetes. So if your diet does not contain any carbohydrates and then you are taking medication, it can bring down your sugar level to a very dangerous level. So hypoglycemia is actually a medical emergency that is dangerous to one's health. Now, I'll tell you some of the signs that you will see that you know that you are hypoglycemic. The common one is the feeling of hunger. You start feeling hungry, meaning your body needs food, needs glucose. Another one is your heart start beating fast. Your heart start beating fast, you have lack concentration, your body starts shaking, and then there's this dizziness. You need to have anxiety, the hand starts shaking, there's tiredness, there's weakness of the body. Some people become unconscious, then the worst of all can lead to coma and even death. So hypoglycemia, as I said, is a medical emergency. It's not something you should joke with. Now, how do you prevent hypoglycemia in a diabetic patient? One, always take your drugs as prescribed by your doctor. Do not exercise when you've not eaten. So don't take your drug and say you can go to exercise without eating. That also can lead you to hypoglycemia. Another means of prevention is always take your regular meal. Always check your sugar level, glucometer. That's why I advise anybody that is diabetic, always have your own personal glucometer, not always going to the hospital or to the pharmacy to check your sugar level. Always have your own personal glucometer that you have at home. You can always check your glucose level. Do not take overdose of your medication in response to trying to say you want to bring down your blood sugar. Do not take overdose. Take it as it is prescribed by the doctor. Now, when you have hypoglycemia, there are certain things you should keep in mind. When you start feeling this headache, dizziness, your heart beating fast, feeling of hunger, and then tiredness, what you should do is carry your glucometer, check your sugar level. If you know that it's getting low, in your house you can have glucose. That one you put in water and then you drink to restore back your sugar level. Or you take any food at all that contains glucose, preferably liquid because it works fast, goes into your system faster compared to solid. So you take it, then check again after 30 minutes, check your glucose level. If your glucose level is still low, you repeat same thing. But when it comes back to normal, then you can go back to your normal diet and start eating your normal food. And then try as much as possible to prevent what caused that glucose level to go down. You can also have honey. Honey helps also. So you take honey, at least a teaspoon of honey will save you. But if this one is for the relative, if you notice that your person is now unresponsive, person is weak, cannot even take anything orally, please do not force liquid into the person's mouth because it can go to the wrong direction. Instead, carry your car or look for any means of transportation, move the person to the hospital. Hospital is the best place for them where they can treat them for them to regain back their normal glucose level.